Welcome to the Heart of Innovation. 60 minutes that could save life and limb, with new breakthrough ideas and innovation changing the healthcare landscape. Brought to you by patient advocacy group thewaytomyheart.org in partnership with Cardiovascular System Incorporated's patient advocacy campaign, Take a Stand Against Amputation. Here are your hosts for the Heart of Innovation, Emmy Award-winning journalist and founder of The Way to My Heart, Kim McNicholas, and interventional cardiologist and founder of the Save My Piggies Health Education Series, Dr. John Phillips.
Hey everyone, and welcome to the show. I'm with Dr. John Phillips, and today we are going to be talking about gaps in healthcare, serving some of the most vulnerable communities who suffer from one of the most debilitating diseases most have never even heard of, yet impacts 1 in 5 over the age of 60. It's called Peripheral Artery Disease, or P.A.D., which is plaque buildup in mainly the leg arteries that restricts blood flow to the lower extremities. Now, we are live. You might hear a little background noise, but we're live at our nonprofit, The Way to My Heart's Making the Impossible Possible patient conference, where we are sharing information with patients about cutting-edge treatments that are available to treat the narrowed and blocked arteries mainly in the legs. So, gosh, Dr. Phillips, I wish you were here.
Yeah, I do too. You might hear a little.
You're in an airport.
Well,
where are you going?
I'm in an airport. I'm in Newark right now. I was doing a educational course for Cook Medical, and we were teaching fellows and early attending actually pedal access, so specialized access for folks with critical limb ischemia, P.A.D, the patients that we're talking about right now. So we had a great time. I'm just waiting to catch my flight, so sorry for any background noise.
No, that's okay. I mean, you got to travel. We want you back.
That's right.
I had the most
How's
crazy
Chicago?
week, though. Oh, no, Chicago's great. It's so amazing. We have about 14 of our friends with peripheral artery disease that are here, excited to learn and go. I'm so thankful I got here. This is, conference is happening following a doctor conference called AMP. And that is a conference where doctors are also learning some of the cutting edge tools and techniques used to unblock arteries in the legs. And ultimately, some of those doctors are going to be sharing what they learned during the conference with a lot of these patients who suffer from this disorder. But I was supposed to come into this conference earlier this week, and then my dad ended up throwing a little wrench into it. He decided to Superman backwards off a curb, and he broke his femur. Wow. He broke his right arm. We ended up in 4 hours away from the house in the middle of nowhere, and he had to be ambulanced to the hospital. While he's in there, my dad has heart disease, and literally they had him laying flat on a bed for 9.5 hours. This is a patient with heart disease, and there was no orthopedic consult right away. The orthopedic didn't even review his records on day one. They kept thinking that he was going to have surgery on that day, so they left him lying there alone in the emergency room until I finally showed up. And I was like, has he used the facilities? Has he used the restroom? Have you given him pain meds? What about some sort of aspirin or Levinox or something? He's a heart disease patient. He's a vascular patient. You can't have a vascular patient just lying on their back for 9.5 hours. And it was really just amazing to me how little the emergency room, the physicians there understood about vascular disease patients. And it's something that I think we need greater education there. And it leads us into what are some of the gaps for patients who have these vascular diseases, such as heart disease, such as peripheral artery disease. And I think one of them is education for even the physicians themselves, other than the cardiologists, right? So it was
Kim,
quite the experience.
A couple of points that you touched on. And number one, I was happy and we were privileged to broadcast some live cases from our hospital in Columbus to the AMP conference in Chicago. So we were able to participate, and we really enjoy that. Number two, with respect to your dad's ordeal in the emergency room, our emergency room is extremely overpopulated right now. Patients are staying in the hospitals longer. Emergency rooms are now using the term boarding patients, meaning they need to be admitted, but they don't have beds for them. So the patients are sitting in the emergency room. And it's really tough because the emergency room doctors, they are not there to, admit these folks and take care of them once they're admitted. So it's creating a little bit of a mini crisis in our area. And I imagine that's what your dad was experiencing. I hope he does well though, and is doing well.
Yeah, he's doing a lot better, but I also had to educate the orthopedic surgeon on the fact that you need to give him some sort of Xarelto or other blood thinner after a procedure for about 30 to 35 days. See, I listened to you, Dr. Phillips. See, I know after listening to you what to do. And so I was able to coach the doctor, and he was able to say, oh, yes, actually, you're right. We do need to do that. Because the last time that he had a hip replacement, he did end up with clotting, and that caused a problem. So this time around, we were able to help make sure that didn't happen. And he's doing much better. He's back home. We had to drive him 6 hours home because of traffic, but I made it.
At least he's doing better. Do we have time for our quote for the week?
Yes, your quote of the day. You're a little bit, I need inspiration.
Yes, my quote of the day. Yes, I need some inspiration. Well, so actually I was in New Jersey, and my favorite football team is Green Bay Packers. Their famous coach, Vince Lombardi, from New Jersey. So I've got a Vince Lombardi quote about perfection. And he said that perfection is not attainable, but if you chase perfection, you can catch excellence. And so, honestly, when we're doing these procedures, sometimes we try to achieve perfection with the artery and get the best looking results. And that's not always possible, but I think if we keep chasing it, we can have excellence. And obviously the conference that you're at is trying to teach physicians about excellence and patient care for P.A.D. And then obviously the things that you're doing are trying to raise awareness for patients also.
I think that quote is so apropos because so many of these doctors, all patients want from the doctor is that they're going to try their best. They're going to exhaust all efforts, particularly with peripheral artery disease, to save their limbs. They're going to do everything in their power to try and do it. And that's why, a conference like this is so important, because I think it's important for patients to know all of the new treatment options, all of the tools, all of the techniques, so they can have a more productive discussion with their doctor about what it means to exhaust those efforts to save life and limb. So coming up in just
I agree 100%.
We're going to have a few doctors that are here to present at the conference. They're going to join us. We have Dr. Kumar Madasari. We have Dr. Jay Matthews. We have Dr. James Antizonas here. We also have several P.A.D warriors, as we call them, folks with peripheral artery disease, including one of our friends who's going to be presenting at the conference, Frank Diaz from Chicago. So we have a lot of exciting things coming up. So stay with us right here on the Heart of Innovation.
Leg health can indicate risk for heart attack, stroke, and amputation. If you have leg pain or cramps while walking, get checked for peripheral artery disease, or P.A.D. P.A.D. is plaque buildup in mainly the leg arteries. Be sure to ask your physician for an ankle brachial index, also called an ABI test, where they use blood pressure cuffs to analyze the blood pressure in your legs. If they discover you have arterial plaque that's limiting blood flow to your feet, medicine and a regimented walking program are frontline treatment. If P.A.D. is in its advanced stages, your physician may schedule a surgical intervention. Minimally invasive tools are available to remove plaque and restore blood flow, including Cardiovascular System's Diamondback 360 atherectomy system, which sands away plaque that is a hard calcium. It's important to discuss all options with your physician, and if told you have no options, get a second opinion. Take a stand against amputation. For more information, go to standagainsamputation.com. That's standagainsamputation.com.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Hi, everyone. Welcome back to the Heart of Innovation. We are live in Chicago today. At least I am. Dr. Phillips is in some airport somewhere. Newark?
Newark. That's right, Newark.
Where he was also helping with, I think you were with a Cook Medical seminar, trying to teach other doctors and clinicians some of the new cutting edge tools and techniques, right?
Yep, that's correct. We're, again, if you're going to treat the patients that we're talking about today, that we've talked about in the past, and that I think we're going to have on the show, you have to be able to be pretty creative with getting the vessels open. And so this course was mainly designed to look for alternative access points, as we call it, or alternative ways to get into the arteries.
Oh, that's fantastic. We always tell folks who have peripheral artery disease to always ask their doctor what different approaches, do you just access the arteries and come down from the groin, or do you also have the ability to go in the arm and come all the way down, or even go into the foot or the calf and come on up and try and tackle a blockage that way? It's really important to have those multiple approaches, in your little toolbox, so that, or at least the doctor does, so that you can give the patient the best chance at keeping their leg. But speaking of some of the doctors that are on the cutting edge, we have Dr. Kumar Madaseri, we have Dr. Jay Matthews here, we have also Dr. James Antizana that's here with us. And they've been here at the conference all week, which is the Cutting Edge Conference, the AMP conference. And they wanted to share just some of the gaps they've found in healthcare for people in the most vulnerable communities who are suffering from P.A.D. or peripheral artery disease, but also maybe some of the solutions they were hearing about. Dr. Kumar Madaseri, I'm going to leave you with the mic.
Well, thank you so much. And great to be here. I appreciate the invite. Great to have John virtually, I guess, somewhere in some bathroom in Newark, New Jersey. But
that's what I was wondering too. John, are you in the bathroom?
Most likely.
I'm sitting across from a very fancy perfume shop, so I smell good at least.
So you smell good.
Yeah, well, it's great to hear from you, John.
He said perfume shop.
Perfume shop, yeah. It sounds made up. So I think the gaps and what we're missing for patients it's probably common to everywhere. What we think is only happening in certain places actually happens right in your own backyard, whether you're in the city or you're in a rural area. I think the biggest gaps come from a lack of awareness, education, and access into a system that we can have that has everybody following a pathway. We don't have a perfect pathway that everybody understands. Other physicians, specialists, and the care that's delivered is very incongruent or not the same for everybody everywhere. So part of it's access, part of it, the big problem is on us physicians to work together with government insurance to kind of make things easier for patients and never get to the point of being on Miracle Doctor's table. Even though we love doing cases, the best thing you can do is not get on one of our tables. So I think we can all do a better job, but in terms of the patients who need it, we need to find better solutions for educations and for getting them into a pathway of prevention, and then proper first-time care if you need something, whether it be endovascular, surgical, if you need to get to that point. I think, to me, that's the biggest gap, is the lack of access for everybody and the lack of us doing a better job working together. Some of the solutions, I think we need to all band together in meetings like this, working with advocacy groups, working with the government, insurance, to try to figure out how do we set up quality-based outcomes and measurements and systems, because the cost of what we're dealing with is the highest cost of all of healthcare. So if we want to help everybody together and help the system, it's by working together on these. So I think we have to come from multiple angles, but it requires all of us to work together. And I love that patients, such as all you P.A.D. warriors and everybody in the audience, are such advocates for yourselves, because really it comes down to you and your families.
Right. They have to fight for their limb. And, I know it's really important that everyone, wants to trust and, the doctor that they like. But the fact of the matter is, especially in healthcare today, and particularly with vascular disease, different doctors, different approaches, different tools, different philosophies, there's so much that's happening. Innovation is happening at the speed of light, and you need to always get that second, maybe third, and sometimes even a fourth opinion. Dr. Jay Matthews, otherwise known as Dr. Miracle. We had several of our P.A.D. warriors or peripheral artery disease patients who went to him and were told amputation was the only option, and he was able to go in and he was able to save their limb. Dr. Matthews.
Well, thanks, Kim, for having me. It's great to be here, and great to be here with this organization doing what I think is really important work in terms of increasing awareness and whatnot too. And I think it's not just awareness for patients, but also for physicians as well too, because what we do see, there is a lot of disparate care. And I think there are a lot of folks that are just unaware of what the options are. It's not just even at the patient level, but it's even at the provider level as well too. So I think this is an ongoing fight. We're going to continue to try to raise awareness as much as we can, and try to get everyone to the same level. That being said, these are really advanced therapies and advanced techniques, and the technology is advancing dramatically. And some of the new things that we're talking about a lot at this meeting and others is different ways of really figuring out when we're done and when we've done a good job, being able to measure even things like tissue oxygenation at the level of the wound with a non-invasive technique. So that there's actually oxygen getting to the wound itself. It's not just a pretty picture, but it's actually something that you've actually done a good job and accomplished, and maybe this wound will be more likely to heal. Other things too, it's just in terms of care coordination and communication, being able to connect patients directly with their physicians, to be able to communicate pictures of their wounds and their feet after intervention so that we can see how things are progressing on a rapid basis. Sometimes it's hard with insurance and just even with access to be able to get in to see your physician in a timely fashion, and just being able to communicate directly with your provider and be able to show them what's happening so that, if we need to do something urgently or emergently, we can do so. And the next level beyond that is, taking that coordination and then combining it with artificial intelligence technologies that will then be able to predict what those outcomes are going to be afterwards. So not just before the procedure, but during the procedure, but even afterwards. So these are some of the things that we're talking about at this meeting and other meetings about future ways of really helping prevent amputation and improving outcomes overall.
Definitely. We also have Dr. James Antizana here. So, we're talking some of the gaps in healthcare when it comes to P.A.D. and some of the solutions, things that you're learning here at the conference that are going to stick with you and maybe even change the game and how you treat patients.
Absolutely. Thank you very much, Kim. It's a pleasure to be talking to this great community of P.A.D. warriors who suffer of a condition that, sadly enough, could have been detected probably earlier on in their state and maybe put a stop to it. I think that medicine obviously is evolving. We're all evolving. The most important thing is communication, creating hotlines for people to be able to reach out, not just the normal P.A.D. warriors, but physicians who are out in the outskirts of the community, who don't have the expertise, who need to get in contact with people like us to do a lot of limb salvage. And we work with very complex catheters and wires and atherectomy devices, et cetera, to get blood flow. I think there's great opportunity in that. But the most important thing is to have physicians communicate amongst each other, as well as having our primary care physicians detect the illness early on in the patient's condition so we can put a stop to it, and improve all the comorbidities, risk factor modification, exercise regimens that would increase collateral blood flow, et cetera. Thank you.
Yeah. So, a lot going on. John, you're missing everything here.
Kim, that's the first time you've ever called me John. So I'm glad you've taken that next step in our relationship.
Shoot.
Just real quick.
Are you
I know, it's huge.
Maybe in my tired state, it's working out for you.
I love it. I would just add a couple of things. Everybody's touched on, the accessibility gap, the care delivery gap, and there's that information gap too. So there's a lot of factors at work that I guess get our patients to that point where they have a wound that probably 3 or 4 months ago they didn't have, that we could have maybe helped them with. So for everything that we do today and we do in the future about the show is it focuses on patient awareness, patient education, and saving the piggies.
I agree. So on that note, we will be right back in just a moment right here on the Heart of Innovation. So stay with us, more to come.
Ago, my symptoms started with leg pain and leg cramps while walking.
Me too, with a tightness in my calves.
Well, do you know, my doctor thought that my leg cramps were a side effect of the statin he prescribed me.
Well, my doctor just brushed them off as another symptom of old age.
Mine thought the pain was radiating from my spine.
My doctor blamed my neuropathy on diabetes until I got a wound on my foot that just wouldn't heal.
Yeah, it turns out we all have peripheral artery disease, also known as P.A.D.
It's plaque buildup mainly in the leg arteries causing poor circulation.
For me, the diagnosis came too late and I lost my leg, but that does not have to happen to you.
No, it does not, because there are treatment options available if you're diagnosed early enough.
P.A.D. Peripheral Artery Disease. If you've been experiencing leg pain, leg cramps, or neuropathy when walking, and your doctor isn't hearing you, we are. We are The Way to My Heart, the largest support network for peripheral artery disease patients, and we want to help you get back on your feet again. Visit our website at thewaytomyheart.org or call our Leg Saver hotline, 415-320-7138. Your life and limb could depend on it.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Hi, everyone, and welcome back to the show. We have Dr. Phillips over in Newark, an airport, on his way back home, back to do cases at Ohio Health in Ohio, in Columbus. And I am broadcasting live in Chicago at a conference where it's almost, there are two conferences. One just wrapped up where doctors were learning cutting edge techniques and tools for treating peripheral artery disease, those blocked arteries in the legs that, caused by plaque build up. And so doctors are trying to learn all of the new approaches and philosophies. And then we also have a secondary conference with patients who suffer from peripheral artery disease that we're now going to share that information that we learned from the first conference with patients directly in our second conference. And one of the doctors that is going to be presenting is Dr. El Sayed Muhammad. He is right here in Chicago. And we're talking, doctor, about the gaps in our healthcare system for patients with peripheral artery disease and some ideas for solutions. Do you want to chime in?
Oh, sure. Thank you so much, Kim. Thank you for having us here today and for organizing this. I think this is very important. Mm-hmm. I can't emphasize much that we have to bridge that huge gap. Yep. We have areas where we have highly experienced doctors doing great care, and in other areas where you have patients that are unable to get access to that care. So it starts with education and transformation of all of that knowledge all across, and informing, I think, very importantly, the patients that they could have their own voice, look for a second opinion, research it for themselves, have access to information to educate their own self, and then also seek the care that best suits them. And I think on our end, we've been working hard with podiatrists and other physicians who are frontline and seeing people who need care, and also advertising, and letting patients know that there are therapies and you shouldn't just fall into an amputation or live with a poor quality of life just because of your disease.
And I think we have too many doctors that are saying, just because they don't have another option, that there's no option for these patients. And that's why it's really important for the patients themselves to feel empowered and do their research and be able to get another opinion as soon as possible, to see that there are different doctors with different approaches, different tools, different techniques.
Yes. I think we've learned so much over the decades, and now there are almost always an option for something to be done. Mm-hmm. And you just have to explore and look into all of the possibilities, and you'll probably find some place that you will get your options and taken care of.
Mm-hmm. Thank you so much, doctor. And, speaking of a second opinion, we actually have Frank, who's here with us. He's in Chicago. He is a P.A.D warrior. He has peripheral artery disease. And second opinion, you had mentioned to me a number of times that that's something that you wish you'd done.
Yes, that's right, Kim. Thanks for having me. Definitely important to be a little more aggressive at the time of the diagnosis. I put all my faith in single surgeon and his team, and I went along with all the different opinions and treatments and everything that followed from diagnosis to amputation. And so if I had known then what I know now, of course, that's easy. But it's certainly very important to close that gap, especially in a big city like Chicago, which is a major medical hub. You would think I'd get up and say, well, I can go to that hospital or that other clinic. They'll take me. They'll help me. But no, it didn't turn out that way. So now I spend my time advocating for patients who should look into a second opinion and see what other options they have for salvaging their limbs.
And you know what? I have another friend here who has peripheral artery disease who is nodding as Frank is saying, hey, it's so important to get a second opinion. Actually, Alan, that is something, you're nodding. It's something that's very important for you and you're doing right now.
Yes, this is honestly a blessing for me. The beginning of this year, I've had P.A.D. for 10 years. Both my legs are bypassed. I have a tibial bypass. I've had well over 24 angiograms with repairs and discovery. What has happened to me in the past 3 months is my legs started throwing clots. And they've done another bypass and so forth. And just recently, don't want to take too long, but I was talking to several people here, and I'm kind of rambling. I'm so sorry.
You're doing great. I know it's always hard. You know, it's a very tough illness, both physically and mentally.
It's such a long story. My story is long, and I'd write a small book. But I thought after just having a thrombectomy,
which is the removal of clots.
That's the removal of clots, correct, in the lower leg. And seeing my doctor, calling him on Sunday, and I could hear it change in his tone on the phone that there was nothing he could do.
That's painful.
And so something's going on. I'm telling him, throwing my arms up in the air, help me. And I went and saw him on Monday morning, and there's just nothing there.
Yeah.
And as a patient, I've been with this group for 10 years, and you put so much faith into them. And even at Cleveland Clinic, having a younger doctor, and this is what I don't want people to do that have this disease, because I almost did it, and it's very recent, is to say, okay, my legs are going to be amputated. Get comfortable with it. You're going to have prosthetics. And I was all set in my mind.
Mm-hmm.
For the local hospital, no other options. I had a young surgeon that's the cowboy of the group in the vascular surgery at Cleveland Clinic.
Yeah.
Tell me there's nothing we can do. The new procedures don't last that long. So they're downplaying. They're seriously downplaying this, knowing that I have a choice.
Mm-hmm.
And so I came home after that visit that night. I said, I joined an amputee group. Let's go ahead on Facebook. Let's go ahead and see if there's a P.A.D. support group. And that's where I met this angel.
Aww.
And within 10 minutes, I had answers.
Yeah.
And I was so ready to give up. And thank you for what you have done to bring change to my life and have a choice.
Of course.
Don't listen to your doctors.
Well, I wouldn't say
Especially
don't listen
to them, but it's the old way of thinking that has to be changed in the medical field.
Right.
And especially you have to advocate for yourself.
Mm-hmm.
So that was the wrong thing to say, because as I understand it, I've never been to Chicago in the medical arena up here to understand that you're treated as a person and not so much you're in a surgery, out of surgery, and get through like cattle.
Mm-hmm. And what's amazing is right here, right now, for the very first time, Alan is meeting Dr. Kumar Madasari, who's right here, who feels the pressure, and that's where he's going to get the second opinion from Dr. Madasari. And just hearing his story for the first time and knowing that you're going to be seeing him very soon and providing him with a little bit of hope, what's your reaction?
First of all, I apologize for what we have done in the system to you. That's not fair. And, we battled this regionally, locally, even within your own institutions, or it happens. We are all not on the same page, and I wish we all were. We here in this meeting are on the same page, and we have a passionate following around the global that we're trying to build. But even within the same area, we can't be on the same page. But I apologize for what's happened to you, and we'll find some way to do something. Now, every single patient who comes in with, let's say you got a car accident, some amputation are necessary, but these amputations should be prevented. These are the ones that we should never get to the point of saying there's nothing left until 3 experts tell you there's nothing left. And that's a very rare situation. The only way we've innovated all these things and we've come up with these techniques and procedures that, yes, we don't have 50-year data on, but if we get you 10 years and we're still talking about the next one by then, we've won, So there's a lot to do that can be done. It's just a matter of all of us working together and networking. I mean, I think this is an incredible network you guys have. There's no such thing like this 5-10 years ago. We just had to wait till somebody accidentally found you. But we hope this network grows like a virus, and we hope that it spreads everywhere. But patients are the best advocates for themselves. Nobody will care for you like yourself.
On that note, we will be right back with the Heart of Innovation. So stay with us.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody. Thanks for joining us on this fantastic show. Kim is live in Chicago. I'm live in the Newark airports. We've been discussing healthcare kind of inequities, disparities, particularly in our patients with peripheral arterial disease. And Kim, several times now you've mentioned a PAD warrior. And I know this is part of the innovation, the weight of my heart and kind of what drives you. But tell me, what's a PAD warrior? Maybe, I guess Douglas is there too. Douglas is a PAD warrior and invented the statement, right? So maybe he can share with us too.
Yeah, Douglas. So you're actually the one who coined the phrase PAD warrior. Of course, peripheral artery disease, P.A.D. or P.A.D. It's a disease, restricted blood flow. For those who are just joining us, restricted blood flow in the legs, mainly due to plaque buildup. It can cause horrible symptoms, leg pain, leg cramps, all of the above. And they have to get a doctor to unblock those arteries ultimately before there ultimately is no option. We're saying that there are more options, but amputation is a last resort. But Douglas, PAD warrior. What is a PAD warrior? Why did you coin that phrase?
The original phrase came to me because I'm also in recovery and I got 40 years in recovery. So I know what it takes. And when I first joined the group and listening to the stories on the internet and on Facebook, it was like, these are warriors. These are people who have been given no hope, that are still getting up every day and taking a step and walking when we don't want to walk no more, when it hurts so bad. And it's like what he was talking about, having hope and having the doctors now that are giving us the hope and us working together. There's no I in team. So it's all of us working together to make the change.
Fantastic. So, John, that's what PAD warrior is.
Right, but Kim, you don't have P.A.D. and you're a warrior as well. Where do you get that fire in your belly to do what you do?
I've always been one that's been very empathetic, and I really feel in my heart of hearts, it's my life's purpose to save life and limb. And it started out with saving my dad's life with everything that I had learned while covering a story about new devices in healthcare to treat peripheral artery disease and heart disease. And then saying, wow, the high touch advocacy, using the information that I'd learned in my journey to save my dad, I need to provide it for everyone else. So I gave up my career in journalism and decided to pursue my life's purpose in saving life and limb and being that high touch advocate for patients around the world. And our network now has 11,000 patients with peripheral artery disease that we are saving life and limb on a daily basis, empowering them with the right information, the cutting edge tools and techniques. And as Douglas said, and Alan before the break had said, it's providing them with hope. Hope is incredibly powerful. Gigi is here. She's also a P.A.D warrior. Hope is really the most powerful medicine really for peripheral artery disease, right?
That's correct. And thank you for having me here. Yes, it really is hope, because I was unsure of what was going to be next. I've seen 3 different surgeons before finally having my procedures done. And I was told that I am not in jeopardy of losing any limbs yet, but I also had a 30-year smoking history that I, of course, had to stop immediately or as quickly as possible, because I didn't want to risk having to go through this again. But I know there are other patients that are much worse off than what I was, because they are in jeopardy of losing limbs and toes and feet and other things. That's not good. So for the doctors to be able to explain to a patient in better detail what they're about to do, that would be greatly appreciated from a patient standpoint, because then we know what to expect going in. Now, I did have fairly good surgeons who did explain things to me. And because of my work history as a medical transcriptionist, I was very familiar with the terminologies. I knew more than the regular person.
You're ahead of the game.
Yeah, I was a little bit ahead of it because I knew what they were talking about. I knew what part of the body we were in and all of that, you know. So, but to have a physician who can actually sit with you, not make you feel like, well, I have to see 5 patients in 30 minutes.
Right.
Because so many times doctors' offices, they overbook these doctors. And coming from where I come from, I see doctors trying to see patients in 10 minutes.
Oh, wow.
But what if I got a question that it might take you longer than 10 minutes to answer? So I just don't want the doctors to feel like, they have to rush through explaining things to patients, especially if it's their first time being diagnosed.
Right, because
you don't want it to be scary.
No, and especially peripheral artery disease is a lifelong journey that cannot be explained in just 10 minutes. It's like, oh, here, your life's changed forever. See you later.
I had symptoms all the way back from 2015 that I can say now, this was going on back then, but I just put it off, kept putting it off. I'm not going to worry about it. It's just, I need to work out. I'm just deconditioned, but it was much more than that. And I wish I just would have had the thoughts to get it checked out sooner.
Were you diagnosed right away when you went in and you complained of the leg pain, the fatigue, the cramps?
Yes, not diagnosed initially, but they initiated the testing.
Okay.
And then I had the testing with the dye and all of that. And then that's when he really sat down with me and showed me where the blocks were. And I couldn't believe it. And from my knee down on both sides, we have 3 arteries down there. 2 are blocked on both sides.
So you only had one vessel feeding blood to your feet.
1, and that is still true today. And the last scan that I had, which was just the Doppler thing on my leg, he said, oh, well, everything's still open. You got good blood flow. But on my right leg, which is the leg with the stents, at my foot, that artery that comes down the middle, no sound.
Oh, wow.
It's like, well, what does that mean? what does that mean? He just said that one is blocked completely.
And did they fix it?
No.
Not yet.
No. I was told that they cannot because of where my shin bone sits and where the artery is located behind that shin bone. And they're saying, oh, it would be so difficult.
And we have actually Dr. Chopra that just joined here. He wants to say a quick thing, and we have 30 seconds. So you have about 20 seconds to say, and then we can have more from you. He's sitting here. He's listening to what Gigi's saying. There's no hope. She has one vessel runoff. What do you say?
Actually, no, we can still open blockages that have been blocked forever. And we can even go from the foot now, from the, yes there's a lot of options.
Wow. Isn't that amazing? Dr. Phillips?
Yeah, again, like we've talked about it, get a second opinion. Don't take no for an answer. Be your own best advocate of the patient.
On that note, we'll be right back on The Heart of Innovation. Stay with us.
Welcome back to The Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Dr. Phillips, it was amazing that just before the break, we had Gigi that was sharing her story of having peripheral artery disease, and her doctor had said, hey, you have one vessel runoff. You have 3 vessels that are in the cap that feed the foot with blood flow. You only have one. The other 2 are blocked, but there's nothing we can do about it. And then Dr. Chopra, who's here in the Chicago area, says, hey, wait a minute. And he walks over and he said, well, no, we can do it. We can open it up. So she just got her second opinion, and she might have a new doctor to see now. Amazing, real time, right? And she says, OMG, I had no idea. That's what we do at the Way to My Heart. And we have one more here. We have Derek, another P.A.D warrior who's right here, who wanted to share. We're talking about the gaps in the healthcare system that and the possible solutions. We have just a couple minutes here. Do you want to share what you have to say?
I just think they need to, first of all, thank you for having me.
Of course.
I just think they need more communication, because a lot of the doctors I went to first with my problems didn't communicate amongst themselves, and just would pass you off on to another doctor. I just feel like it needs more communication, and you have to get with somebody soon, because it progresses extremely quick. I know with mine, it started with a toe and it immediately progressed to having 3 or 4 amputations almost immediately. So you just more communication, get your care quickly, because it will progress too fast.
And also more consistency in the diagnosis. You weren't even diagnosed with peripheral artery disease right away, actually, until after your first amputation. What did they tell you had going on that was causing or leading to the amputation?
And you're right. They didn't say anything about P.A.D. I never knew what P.A.D was until after they cut a couple of toes off. They were just saying it was complications of diabetes.
And that was it?
That was it. That's all they were leaving me with.
Wow. And then you didn't even have them try to unblock your arteries until after, 2 amputations?
2 or 3 of the toes were off, and they said they wouldn't go below the knee because it was radical.
And so because it was radical. You hear that, John? It's crazy.
Well, that is crazy. But at the end of the day, like, we've been advocates for patients for, all of our shows here, Kim. And it just, I think about, and maybe it's not the best analogy, but I think about someone getting a cancer diagnosis and then, going to an oncologist and getting a treatment plan that may not jive with what they're thinking or whatnot. Most people get second opinions for cancer therapy. So everybody should get a second opinion that has this, has P.A.D. or critical limb ischemia, in my opinion.
I think that that's incredibly important as well. And I think that is, as we wrap up here with our final thoughts and the message that we really want to get across to not only P.A.D warriors or people who suffer from peripheral artery disease or any vascular disease, heart disease, always get the second opinion. And that's really what we're learning, that different doctors, different tools, different techniques, different philosophies. You have to be your own advocate. And yes, you might want to trust and like your doctor, and they may be the best person in the world. They might be the number 1 in the world, but it's really important for you and in saving your life and limb, that you always get a second opinion. And on that note, we really appreciate everyone joining us, all of the P.A.D warriors, the doctors, for participating in our show today and being so candid. Have a great weekend, everyone. Go to theheartofinnovation.org to find out more and see all of our episodes.
You've been listening to The Heart of Innovation with Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips. Our mission is to help patients live a better quality of life through comprehensive education, real-time support, and high-touch advocacy in partnership with thewaytomyheart.org and Take a Stand Against Amputation. Our purpose is to reduce the 1.5 million heart attacks and strokes and nearly 200,000 amputations annually. For more information regarding topics you've heard discussed on today's program, go to theheartofinnovation.org. That's theheartofinnovation.org. The Heart of Innovation is for educational and informational purposes only, and advice and views shared are not a substitute for medical advice from your own supervising physician. Do not act on any information provided in this show without the explicit consent from your own healthcare team. If you think you are having a medical emergency, call your local emergency number or go to the nearest hospital or emergency